Hey everyone, it's Matt from Dynamic Podiatry. I hope you're all really well today. Today I'm going to do a little video on ankle injuries. So I'm going to talk about the anatomy of the ankle. I'm going to talk about which parts of that anatomy can get injured when you do an ankle. And I'm going to talk about rehab and what chance you are of getting back to the activities that you love to do to keep you happy and well. Okay, so this is my trusty little foot and ankle model, and I'm just going to show you, it doesn't show the ligaments on the model, but one of the first things that happens when you do an ankle injury, when you do an inversion sprain, as it's often called, this is the right leg and it's tipping out that way, so it's inverting severely, often with a lot of weight coming down on it. And it happens a lot in sports like basketball and netball. Netball particularly because you go sideways and then have to stop, and sometimes your body will keep going and it'll tip the ankle that way. Basketball because you're doing a lot of jumping up and landing, and in the case of my son's one, which I'll be showing you soon, he actually landed on somebody else's leg, which was an unstable surface, and that caused him to invert the ankle and injure it. So what happens when you injure an ankle is usually the ATFL is the first one to get injured. And if you only do a minor sprain, you'll probably do a stretch of that ligament, and that might be all that really happens. But if it's more severe, there'll usually be a lot of structures that get injured, and the CFL and the PTFL can also be injured. So this is the anterior talofibular ligament that comes down in here, and this is the calcaneal fibular ligament and the posterior talofibular ligament at the back there. And they can all be injured in some cases. What can happen in a really severe one, and it's in the case of the one of my son's, which I've just got up there now, that is the worst bruising that I have ever seen in an ankle. And what happened with his, on the MRI, it showed that all of these ligaments had damage and the ATFL had actually been ruptured, which is quite common. But not only that, he had some bone bruising in the talus because of the pressure coming down through the tibia onto the talus. It actually caused some bone bruising there. And he also got crush injuries to the very strong deltoid ligament, which is actually a set of 5 ligaments on the medial side of the ankle. So he got some crush injury to that. So that's what can happen in a very severe ankle incident. But you'd be amazed, he got back playing basketball 8 weeks after that injury, and that was on the advice of one of the top foot and ankle surgeons in Queensland. So what happened was I put him in a boot straight away because it was so painful and swollen. And then we got into our surgeon as quickly as we could, and that's at Dr. Forster. And he said, he checked everything out. He said, yes. He said, actually, I showed that one around his own clinic because he said it was a doozy the way it looked. But when he examined Ben's foot and ankle, he said, no, that's all right, yep, that's okay. He realized that the damage wasn't as severe as what was showing up on both the MRI and just looking at the foot and ankle. So he told him to get out of the boot. He said the boot's done its job for that short time, and start walking on it without a boot. He said it'll hurt a little bit at first, but you'll get used to it, and play a game in 6 weeks' time. He said you'll be right to start in 6 weeks' time. Once it's not as sore, start doing your rehab exercises. And he basically said, you can get your dad to strap it if you need to, and things like that. And he played 6 weeks after seeing the surgeon, so a total of 8 weeks after injuring the ankle, and was fine. It was quite incredible. I was really, really stunned myself. So ankles can rehabilitate very well. Obviously, he's a younger person and it will rehabilitate better when you're younger, but we can get you back normally to the activities that you want to do by doing a really good structured rehabilitation plan for you, okay? When you first do your ankle, the first thing that either a doctor or a podiatrist will usually order is an x-ray. Now be aware that an x-ray will often not show a single thing. Don't be distressed by that. We know there's still a problem with your ankle. It's just that the x-ray will not show soft tissue except to show a little bit of soft tissue swelling. Okay, so what I will often do if it looks bad is an MRI. An MRI is the gold standard imaging for these types of injuries, and it will show all of the soft tissue, and it will also show the bone and any bruising in the bone, any ruptures or strains of any of the ligaments, including the lateral ligaments, the medial ligaments. It'll show the cartilage and everything. It's a really great exam, but it does cost $185 at the cheapest. That's when referred by a podiatrist to a place like Metro Radiology. Our goal is to get you as active as you want to be and pain-free. So we would tailor a rehabilitation program designed specifically for your age and for your ankle injury, depending on how severe it is. And the plan will be to get you back walking and then to get you back into full activity as quickly as we can. Remember that foot and ankle injuries can take a full 3 months to recover, and some injuries will be permanent. Say if you have fully avulsed, that's where a little piece of bone comes off with the ATFL and it's no longer there. But it doesn't mean that you can't get back to the activities that you want to do. You can still do a lot of walking and things like that without your ATFL. So if you've got any concerns at all about your ankle injury, place a comment on the video or give us a call on 3351 8878. We will answer your questions, and if need be, we can book you an appointment to have you fully assessed and see what type of a program we need to get you back to being your best. Thanks very much, guys. I've enjoyed shooting this video. I hope you enjoyed watching it. I hope it gave you something useful, and I'll do another one next week on the rehab of the ankle. Thank you.